Nurses are needed nationwide, including right here in Baltimore. And if you have ever considered launching a career in nursing, now is the perfect time. With me now is Dr. JoAnn Ioannou, Senior Vice President of Patient Care and Chief Nursing Officer. Welcome.
Thank you. Thank you for having me.
So happy to have you here. And I know that you say now is the right time to consider nursing. Why is that?
Well, nursing is such a diverse profession that there's many aspects of the nursing care that anyone can engage in, whether you want to be a bedside nurse, whether you want to be a nurse practitioner, a clinical informatics specialist, an educator, there's case management. The sky's the limit in nursing.
Wow, it is so many different specialties.
Yes, very, very, very diverse, where I think most people think you become a nurse and you do one aspect of nursing. But the opportunity in nursing has grown tremendously over the last 20 years to the point where there's doctoral nursing practice, there's PhDs, researchers in nursing. So the gamut is very large in terms of what you can do as a nurse today.
And you said starting your career or continuing your career, if you do it at GBMC, it's going to be a different experience. How so?
Well, we have the philosophy of mentorship and fostering new nurses who come into the profession. Mm-hmm. Coming from that venue where you come as a new graduate, even as a nursing student, once you graduate, you become certified and we will grow you. We have the professional excellence model at GBMC, which has multiple opportunities where you become an RN1 as a new grad and you can take it all the way up as an RN4. And then if you want to continue your education, we provide tuition reimbursement and scholarship. If you wanted to become a nurse practitioner or another advanced degree in nursing, we also create those opportunities so you can start as a new grad and you can take it up to the highest levels of leadership.
That's amazing.
And even become a director, those type of avenues.
Wow, so you really walk someone through every stage of their career.
Correct. We at GBMC Healthcare really believe in investing our time in new graduate nurses and making them feel that they're a part of the organization and not just coming to work as a nurse for a few years. We really want to take the time and invest in our new nursing staff.
And that's what I was going to ask you. What are some of the challenges that you think the nursing profession or nurses in general face right now in this day and age?
Well, you know, there's another side to that coin of how diverse nursing has become in the profession. The challenges that we're facing now is keeping people at the bedside because there's so many avenues that a nurse can take. And because the sky's the limit, the challenges is keeping people at the bedside longer than, I would say, on average, people who start in nursing leave the bedside in 2 years. So, you know, there's still going to be patients who have to be admitted to the hospital. So the challenge is now is to entice people why they want to stay at the bedside. But also encourage them to move on and grow their careers. But we have to have a balance. And there's a generational gap. There's, you know, the Gen Xers, there's the baby boomers who are retiring. We have the millennials. So looking at what each generation is really needing and wanting, and that's why nursing happens to be challenging.
Got it. And so, but I love that you provide the support, especially with GBMC. If people want more information, they can go to gbmc.org/notjustanurse. I love that. Dr. Ioannou, thank you so much for joining us. And we'll be right back with more Midday Maryland right after this. Stay tuned.